Hi, everyone. Thank you so much for joining. Welcome to Zoom into our majors, health sciences. We are going to get started very shortly. But as you join, you'll note will remain muted for the entirety of the presentation. So please keep yourself on mute until the end. There will be time for question and answer at the end of the presentation. In the meantime, please feel free to start saying hello using the chat feature. We will be answering questions and speaking with you via chat, so feel free to start utilizing that. As soon as you can introduce yourself there and say hello. We're excited to have you here today. Before we get started and as students begin to join, I just want to review a couple of housekeeping items. So we want to make sure that we know who you are and we're able to stay in touch with you after today. So to do that, we want to make sure that your name is displaying as your actual name on your Zoom. So if you are on an iPhone or if your name is not correctly, it's displaying as your first and last name, please take this time to go ahead and update your Zoom name. Natalie just posted some instructions in the chat on how to do that, but I'll also walk you through. In your video picture or your picture, you will see on the top right-hand side, your mute button and also 3 dots. You'll click on the 3 dots, select from the drop-down, rename, and then you'll just want to rename yourself to your actual first and last name. Okay, so please make sure you do that. This way we can know who you are and stay in touch with you after today. And again, for those who just joined, I know some joined midway, welcome again. My name is Erica. I am the Assistant Director of Recruitment at Bronx Community College in the admissions office. I'm joined here today with my colleague Natalie Gilcrotty from the admissions office as well. Between the two of us, we will be hosting the presentation and we'll be answering your questions in the chat. So if you have any questions along the way, please feel free to ask them in the chat and we will be responding to you there. We're also joined by our wonderful professors today, Professor Charmaine and Yulana from our health sciences major, and we will get to them shortly to get to the stuff that you're here to hear about today, which is our wonderful majors that we offer. So we are just about at 4:05, so I want to make sure we have enough time to cover everything and get started. So let me just go ahead and start sharing. All right, so welcome again. Today we will be zooming into our health science majors, which include our public health major, dietetics and nutrition, exercise science and kinesiology, and therapeutic recreation. Just to give you an idea of what we'll be doing today is introductions, which we already did that. You'll have a chance to hear from our BCC prep professors. There will be time for question and answer at the end. If you, like I said, please utilize the chat, but there will be time at the very end to unmute yourself and ask any questions that you have. And then we will go over steps to get started at BCC through the admissions process. So without further ado, I want to go ahead and turn it over to Professor Charmaine to get us started in our health science majors.
Okay, so welcome everyone. I request if you have a pen and pencil, well, not if you're driving, Nestor, but the others that have a pen and pencil, because we'll be discussing 4 different majors, and you know, you might forget some of the questions along the way. So it'd be a great idea if you can have a piece of paper with you. So. Okay, this is the one. Okay. All right, where is the?
You have the slideshow.
I'm trying to get the slideshow, the full screen.
Yeah, it's right up there. Right
No,
up.
it's covering it. My the new share, it's covering, everything is covering it.
You're hovering, you just hovered right over it. It's just click slideshow.
Yes, but I can't, it's not up here. I'm trying to,
Okay. Charmaine, if you move up a little bit, we'll just guide you. Move up a little bit. No, just. I wonder if she's saying the names are over it.
the names are, the mute and the stop
You know-
video everything is over it. I'm trying to,
Charmaine, if you go to the, well, I don't know if she can switch it from there.
I mean, you can also just use it in this feature. If you're not able to play the slideshow, that's fine too.
what do you think, Yolanda? I'm trying to get into the slideshow.
But Charmaine, if you just take your, I'm going to guide your little arrow. If you go to the corner of where the black screen starts there, where it says majors, but to the right, the big screen, the big picture of the majors.
Yeah,
But yeah, right there. But go a little to the left to where you're right on that line where the gray and the black is. You see where the gray and the black is?
yeah, this one?
Yeah, a little bit more to the right. Literally to the line. Literally to where the black and the gray come together on the big screen, the big picture right there. Yeah, right there. And just move straight up slowly. Just go straight up slowly, 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 slowly. I was going to guide you to it a little bit more. Just, I know you don't see it, but if you trust me, I'll move you a little more. Just keep going even though you don't see it. Keep moving it a little more, a little more, a little more.
Mm-hmm.
A little more still. You keep moving it.
It's not, it's hovering, it's blocked. The
You
mute,
can't, yeah. No, I understand that. Yeah, I don't know how she can move the names.
Just moving forward, just in this screen, just you can continue to present and just go through each slide.
Yeah, I guess you can. Yeah, you can just go through the smaller slides. That's fine. It should be okay.
Yeah, that's
okay.
it, just
Yeah.
fine.
I apologize, everyone. We had it all planned, best made plans. But anyway, so I want to introduce to you Professor Yolanda Lizniak. She's going to be presenting with me, and her email is here. She is the coordinator of the Exercise Science and Kinesiology Program and the Therapeutic Recreation Program. So she's going to describe these two exciting programs in the next few minutes. And my name is Professor Charmaine Alliong, and I'm the coordinator of the Dietetic and the Nutrition Program. So I'm a registered nurse and I'm a registered dietitian, and I am here to answer your questions. And my email is here as well. We have another professor who's not able to be with us today. Her name is Stacia Reeder, and she's the coordinator of the public health major that we have, but I will be covering for her and taking questions. Now, some of you, I've been told, are very interested in the field of health. Some of you may just be curious. Maybe you're interested in something else. But if you're interested in the field of health, it is important for you to see if this is really what you want to do. So first of all, you start with yourself. Is health important to you? If it is important to you, then I know you feel that you want to spread the word and have everybody else interested in their health and their welfare. And you know, there are many aspects of health, as you know: physical, emotional health, social health, intellectual health, all these environmental and spiritual health, all these health aspects are covered if you have a degree in health and if you have an interest in health. All these things are combined to keep us balanced in life. Now, if you want to make a difference in other people's lives, the knowledge that you get will help you to do that when it comes to health, keeping people healthy and well. So this is what being in the health field will give to you, and will give you the knowledge you need to help you promote wellness and health. So what type of skills do you feel you have? Do you have good people skills? Are you a good communicator? Do you treat others with respect? Do you have good listening skills? Are you empathetic, sensitive to others' needs? All these things are necessary to be an effective health communicator. And, you know, we live in a global world, and it is good to be able to work with diverse populations. So if all these things sound good to you, you may enjoy a career in any of these 4 fields. Okay, so here I'm going to introduce exercise science and kinesiology associates program with Dr. Ilana Lisniak.
Well, hello, everyone. Thank you so much, Professor Aliang. I'm very glad to be able to do this virtually so all of you can relax, get into your favorite chair or car, and listen up as we talk about the great programs and careers that our health, physical education, and recreation department can offer you. Now, this is my major, so it's very exciting to be here to present exercise science and kinesiology to you. Now, the Exercise Science and Kinesiology Associate Program is the study of movement and also adaptations of movement. It involves many different areas. It involves physiology, nutrition, psychology, motor control, and biomechanics. And that's just naming a few of the areas that we cover. These areas of discipline that we study are then integrated into the academic preparation for one to become an exercise science professional. And as an exercise science professional, you will learn to make assessments of your clients and assess their physical fitness. And then you'll be able to design exercise science program or exercise programs for your clients, prescriptions that they can follow. Video, please. Next.
When you enroll in NASM, you can expect to learn the foundational principles that are involved in exercise science, biomechanics, and kinesiology. What you're also going to learn is how to put that information into a program for a client. That program is the OPT model. It takes into consideration not only the individual and their needs, but also the environment in which they're performing. So whether that's an individual working out in a gym, or if it's an elite athlete playing basketball, it doesn't matter. It takes the entire three-dimensional approach of that human into what they want to accomplish for their goals.
The OPT model is not just for athletes. It can be even more important for individuals who have special needs, whether it's senior citizens, clinically obese, where they have heart disease or diabetes, because we can take those specific individual needs and then apply them into their exercise program to get the results that they're looking for and improve overall quality of life. We'll start with an assessment. We'll assess the client's goals, needs, and abilities.
One of the most common assessments that we do at NASM is what's called the overhead squat assessment. What I'm doing here is I'm looking for symmetry on both of his sides, as well as his ability to move in the primary components of the kinetic chain. So his foot and ankle complex, I'm also going to look at his knees, what his hips are doing, and then what's going on at his shoulders. We look at that client from the front, from the side, and the back to make sure that they're moving exactly the way they should be moving.
By being able to look at how a client moves, that gives us clues of what exercises we should use. And once we gather all that information, then we can create a systematic program that will progress them up the levels.
The optimum performance training model is a systematic and integrated approach aimed to get any client to any goal. It's 5 phases that are split into 3 levels: stabilization, strength, and power.
Stabilization means we're going to work on endurance. We're going to work on stability of your joints. We're going to work on posture.
The first phases are made for deconditioned individuals, and it builds this very solid foundation of stability that then moves someone up to the next level, which is strength.
We're going to add load and mass to your workout. So we're going to use a little bit heavier weights. We're going to move a little bit faster, and we're going to get your muscles stronger.
Once we have good stability and we have good strength, then we can add in the power stuff that everybody likes to do. So it's an integrated training system. We use flexibility training, core training, balance training, plyometric or reactive training, even speed, agility, and quickness training. You combine that with resistance training and cardiovascular to create a complete program.
The optimum performance training model yields superior results because it allows for greater core strength, and it also improves balance.
The optimum performance training model is proprietary to NASM.
The OPT model was developed over several years, and then it was validated by researchers at one of the leading institutions for sports medicine.
You're getting some of the best science out there combined with a model that's been proven in a clinical setting.
You don't need to have any prior experience in kinesiology or exercise science. We're going to teach you all of those things.
It's important for prospective personal trainers to get this type of education because everyone has unique needs and unique goals. So the OPT model allows you to assess and evaluate each client differently and then implement intervention and training strategies that make most sense for that client.
Just the next slide, yeah. So exercise science and the kinesiology degree program will prepare students for various degrees that are related to all those sections here that you see, the different fields that you see on this list. So let's just talk about each one. If you were to graduate from our program, you can possibly work in a medical setting. That means a hospital, a clinic, perhaps a community health agency, nursing homes, rehabilitation centers. And the work that you would be doing would be related to rehabilitation and disease prevention. You can work in governmental agencies. This would mean any Department of Health. The National Institutes of Health, located in Bethesda, Maryland, right near Washington, D.C., they just recently launched a very exciting program that is a physical activity research program, and they're hiring a lot of fitness professionals. So with this type of a route, you'd basically be dealing with either public health policy or research. Now, maybe you want to be in education in schools or colleges or universities. Now, you may need to attain some additional educational certification, but one can be a physical education teacher and or coach on the elementary, the middle school, the high school, or even the college level. There's work in athletics. One can be an athletic director, work as a strength and conditioning coach, maybe an athletic trainer, a wellness specialist, or even a sports marketer. There are many opportunities in athletics. Now, at the not-for-profit community recreation programs, you can work in the local YMCA or YWCA, and also community centers. In community centers, you can get an entry-level job, and eventually you could be running a community center. And in the for-profit industry, there's possibilities to work in gyms, in hotels, and also in country clubs. And in all of those, you can be a recreational or leisure supervisor, you can be a gym manager, a fitness director, and possibly some sort of a director of recreation. And there's possibilities people have jobs as camp directors all year long, where they're planning for certain fitness type and exercise type camps. So those are all possibilities. And then if one wants to go more into an area of management, you can be a recreational director, where you are responsible for programs and activities for individuals and groups, and you're the one who will be hiring your individual instructors and managers to help you implement these individual programs. Now, I want to tell you that as you graduate from BCC with a degree in exercise science and kinesiology, you're definitely on your way to becoming a fitness professional or a personal trainer. And there are possibilities of working in fields that you may not have thought of. And I want to talk about some very specific jobs. If you like technology, you can become a fitness tech engineer. This sports engineer requires expertise in technical skills. That could be anything from mechanical design to aerodynamics, to computer modeling, to materials science. And you could end up designing equipment or working with athletes to understand their interaction with equipment. And then you could help to improve their performance. So if you have an interest in technology, this could be the perfect field. One can work in the military as a civilian. You can work in health and fitness. Every part of the military, let's say, for example, the Army, they run its own fitness centers. It would be just like any civilian gym, and they hire educated and certified industry professionals to manage the facilities, to teach exercise, exercise groups, and to work as personal trainers. And the pay there is very competitive with the civilian market, and very often it's better, and it usually comes with full medical benefits. By the same token, one can also work with the police department or fire department and also as a civilian. And the description is very similar to the one that I gave above. One example is the New Jersey State Police. The New Jersey State Police, for example, has an Office of Health and Wellness, and they provide their members with wellness resources to enhance performance and reduce sick time and also improve the quality of their life. So you can be involved in fitness assessments and exercise prescriptions and just doing seminars on health and wellness for them. Another possibility is working with professional sport leagues or sport teams. You can work in the WNBA, the NBA, the NFL, the MLB, the MLS, the NHL, the NWSL, et cetera, et cetera. These are all abbreviations for professional teams in basketball, football, baseball, soccer, and hockey, and more. And it's not just working for the actual pro team itself. A lot of the pro teams have camps, they have minor kind of league teams, they have many fitness professionals that are hired to work with them. So those are all possibilities also. Next, please. So from Bronx Community College, you would get your AS, and then you would have to study a little further for a certification exam if you wanted to end there. The great thing is that we have an articulation agreement with Lehman College, so you can go straight there after our degree and enter with 60 credits. You're halfway done to your 4-year degree, and you'd be much more prepared than for the certification exam. 2 other schools that we are working on getting articulation agreements, but you could go there and they would accept maybe all of your credits anyhow, would be Brooklyn College that has a BS in exercise science, and Queens College that has a BS in nutrition and exercise sciences. Now, if you wanted to go the way of kinesiology, physical education, you can also go into those programs at Queens College, at Brooklyn College, and York College also has a health and physical education program. And there you can become a physical education teacher on the elementary, secondary, or middle school, middle school levels. There's also the possibility of being an athletic trainer. An athletic trainer is akin to being a medic in the Army or any of the services, where you're just trying to get somebody, you're trying to fix any kind of a situation so that the athlete can still get up and play in the game, or very quickly still be, get healthy. They might have a sprained ankle or something, and you are the main person in charge to get them up and going so that they can still be active as best they can be, even if they have an injury. So an athletic trainer is a different type of training. There are schools that have athletic training that you could continue on to: Stony Brook, Hofstra, Marist, Poughkeepsie, and LIU in Brooklyn. But one can also finish their exercise science degree and then get a master's in athletic training if that's something that one wanted. And that degree goes very well with also being a personal trainer, because you really have a lot of capabilities to also work with those professional teams as a trainer and as a personal trainer. Next. Now, the employment outlook for exercise science professionals is excellent. The employment of personal trainers, athletic trainers, and exercise physiologists is expected to grow about 15% by 2029, and that's considered much faster than average. Physical education teachers are also very much in demand, especially on the elementary school level in New York City. And just the interest in fitness in the last few decades has really sparked the expansion of health and fitness. We are also now finding that with this pandemic that we've gone through, many more people are now interested in getting back into shape. So that also works to the advantage of anyone who's a fitness professional. Now, the median national salary, and that means the middle score, is about $48,333 per year. The personal trainer salary, the average national salary is around, once they're established, around $61,000 or so dollars. If you work in New York City, the average salary is higher. In the state, it's also around 61,600, and in New York City itself, it's around 74,000 on average. These are all salaries that have been gotten from salary.com, Glassdoor, ZipRecruiter, and so forth. And if you go by way of being a fitness director, your salary can go over $100,000 a year. So you could be the director of a center. And this is what you can expect from an exercise science and kinesiology degree. It's a very rewarding and exciting career. And I hope some of you are interested. Thank you. So now we go into the second program that I am the coordinator of, and this is Therapeutic Recreation Specialists. Now, therapeutic recreation specialists work alongside of physical therapists and also occupational therapists. And let me tell you a little bit about those two, because those are similar degrees, but yet very, very different. The purpose of physical therapy, most of you probably know this, is to reduce pain, improve strength, improve mobility, and prevent or treat any kind of permanent physical disabilities that a person may have. And physical therapists use exercises, they do stretching maneuvers, they do hands-on therapy, they'll use all sorts of equipment. All of this is done to ease the patient's pain, help them with their mobility, and just prevent any further type of an injury. Occupational therapists, they will work with very purposeful activity and interventions to help a patient achieve functional outcomes. Very often they might deal with, let's say, a stroke victim, and they want to help their clients achieve independence in all of life activities. And that could be in the home and also at work. So they'll help patients with daily living skills, like getting dressed, using eating utensils, and also occupational tasks, like using a computer, as their clients and patients deal with temporary or permanent physical or cognitive impairments. Certified therapeutic recreational specialists or therapists will devise activities involving exercise, sports, aquatics, crafts, animals, possibly leisure activities, and have them go on community outings. Also, they will work with obviously medical patients and also people with disabilities to maintain or increase their level of physical, social, and mental well-being. And as you just heard, that's a little bit different than the way physical therapists and occupational therapists work with their clients. Recreational therapists focus on the quality of their lives of their patients, and they want their patients to sustain their quality of life, and they do that by using these leisure activities and recreation to be able to obtain that. Next in video, please.
Make your eyes break.
Okay, so that was a really, I love that video. It makes you want to get up and go. So therapeutic recreational specialists predominantly work in either clinical settings or community settings. Now, if they work in a clinical setting, you'd be working in a nursing home or a hospital. So in a nursing home, a TR staff member may help residents with their long-term day-to-day function because people do want to be physically active as they become older. In hospital, specialists might work in acute care where they work with serious illnesses or injuries on a short-term basis. They might work in outpatient care where they can actually go and provide their services at a home. They can work in psychiatric care that could be done in both long-term and short-term. And they might work in a rehab center where they would work with disabilities from illnesses like strokes or accidents. In both cases, they're trying to help the patients to adapt to their disabilities. And in these cases, the patients are learning to meet their needs by using recreation to re-engage with life through leisure activities, so they stay healthy as well. In community settings, this is where there's a far greater number of people with disabilities. You could be working with public parks and recreation agencies. They will hire TR specialists to oversee their programs for inclusion purposes. So if someone is deaf or has a physical disability, they can learn to participate with people who don't have those disabilities. A TR specialist might also make sure that there are ramps built so that people with disabilities have access to facilities. You can work on cruise ships. TR specialists work on cruise ships, they see the world, and they are activity directors, and they make sure that people on the ship of all ages are included in the physical activities that are being done. And with their knowledge, they know the type of activities that young children might want, the type of activities that teenagers might want, the ones that adults want, the one that older generation people might want, and then activities even for the elderly, and they're in charge of all of that. And then one of the highest paying jobs is working in prisons, where TR specialists will lead and instruct patients in both individual and group activities of either a physical, social, or cultural nature. And this could be done with indoor games, outdoor games, possibly sports, dance, dramatics, or even all sorts of special interest clubs. And they also plan treatment goals for specific patients and work alongside the therapeutic team that is working with that patient. So sometimes along with doctors and so forth, and physical therapists. Next. And our therapeutic recreation program has an articulation agreement with Lehman College, which is really excellent. And you can receive your 4-year bachelor degree there. When you earn your bachelor's degree, you then take the National Certified Therapeutic Recreational Specialist exam. And to get a job, no further training is necessary after you pass the exam. This is very different to the first 2 degrees that I spoke of. I spoke about being an occupational therapist, and with that, you do need a master's degree. And then I spoke about a physical therapist, and with that, you need to have a doctoral degree. So this is where therapeutic recreation is very different, at least until now. Still, you only need your bachelor's degree and to then take the national certified exam and pass it. Next. The salary and job outlook is very good. The employment of recreational therapists is expected to rise about 8% from 19 to 2029, and that's considered faster than average. The median salary is about $49,694 per year. And look at the differences here. If you wanted to be a recreational aide, you actually can do that right now. And you might get paid, if you're hired, even $12 to $18 per hour once you have your high school degree. After that, if you get your AS, look what happens as a recreational aide. Your salary doubles or more than doubles, and you might earn $25 to $35 an hour. When you get your bachelor's, your salary goes up even more. It's actually even a little higher. I need to update that. It's probably somewhere between like 42 and 53 or 54,000 per year. And then if you get your master's, you can become a recreational administrator, and your salary goes up even further into the $50,000 and $60,000 range. And I mentioned how prison jobs and being a recreational therapist there pays very highly. It really does. It starts with salaries of about $70,000 a year. So this is also a great career, and it's one that is looked at very, very positively and really, really growing. So thank you very much. So now I want to introduce Professor Charmaine Aliong, and she will talk about dietetics and nutrition science and the associate degree.
Okay, so good afternoon, everyone. Some of you may have recently joined in, and my name is Charmaine Aliong. I hold a degree in dietetics and nutrition, and I'm also a registered nurse. But the reason I became interested in nutrition is because I wanted to look at treating and preventing diseases rather than talk about working with illness. Anyway, so dietitians do both. They work to help prevent disease, and they work to help treat people with certain illnesses to get better, focusing on nutrition. But they're considered, dietitians / nutritionists are considered experts in food and nutrition. My particular emphasis is looking at the well individuals and help them stay well. But you know, they advise people on what to eat in order to lead a healthy lifestyle or to achieve certain specific health-related goals, maybe weight management, maybe hypertension, heart disease. Okay, so this person, I'd like this video, it's going to give you an overview of the field.
It's such an exciting time to work in food and nutrition. Everywhere you look, there is a growing interest in the connection between food and health. And with this expanding awareness comes the need for more people like you to choose a career in dietetics.
The field is always growing and evolving, and there are so many different career paths you can take at this point in time. It used to be kind of cut and dry, but now if you can dream it, you can do it.
The science of food is so interesting to me because everybody eats food. So it's relevant to everyone, and you can really make a difference in people's lives.
There are so many reasons to pursue this unique and valuable career path.
In thinking about what I wanted to do as a career, I always just thought I'd go into medicine, go to medical school. But the more I thought about it, I realized what I really wanted to do was to help people prevent illness. And to me, nutrition and dietetics is the perfect fit for that.
I went into nutrition because I absolutely love food, and I think it's very important for people to understand how the food that they're eating affects their health and their bodies. And that's what everyone is interested in.
There are so many reasons why I went into nutrition. I think the main reasons were influenced by my diagnosis of thyroid cancer, and this influenced me to want to take something that I've always been passionate about, which is food, and create healthy options for people.
Dietetics is a great way to kind of merge a love for medical knowledge and health with a love of food.
From schools and supermarkets to restaurants and athletic fields, the professional opportunities are endless.
When I went into dietetics, when I first started out, I thought the only thing I can do in dietetics is work as a dietitian, registered dietitian in a hospital, and that's it. But now that I'm here and now that dietetics is such a growing field and more people are interested, you can work in schools, you can work in outpatient, you can go to patients' homes. I think it's really important to know that with a major in dietetics, you can work in almost any type of setting you want.
Why I love working with children is because you can make them as passionate about food as you are. Just a simple message will impact a child's daily life all the way up until they're adult.
Sport nutrition combines the best of all possible worlds. It's our culinary expertise, it's our clinical expertise, and you get to work with active people, telling them what to eat, when they eat it, and how much. That is a home run.
As a supermarket dietitian for Myers stores, I help consumers sort through the confusion because all those decisions about what they're going to eat starts in the grocery store. And that's where we become a very valuable resource because we can guide them and show them how to make those healthier choices. At Vital Bridges, I provide one-on-one counseling either in person or through telenutrition sessions. Along with that, we provide food specifically for people who are living with HIV/AIDS.
Right now, I'm working in health IT. So as a dietitian, there's not that many of us working in this area. So my challenge right now is to be that trailblazer to make that path for us as nutrition professionals working in the health IT space.
I've spent most of my career working with diet-deprived children and underserved populations. The greatest impact that I could have as a dietitian was to work with people who didn't have enough food and to make sure that I increased awareness in all ways so that we made sure that people had enough food.
With a career in dietetics, you are guaranteed to experience the reward of helping others and changing lives.
Nutrition is the one area where we can intervene and actually change people's lives. How many jobs can you say that my job every day is to make people feel better, live longer, and to be happier? And we get to do that as dietitians, and that's why nutrition is so important.
I've always just loved to help people and to share information. And if I can do that and help improve their lives, that's just the best thing.
It's always exciting to see the fruits of the labor, so to speak, that what it is that they put into their body is translating to allowing them to run those skills, to hit those home runs, to throw somebody out at the plate.
I find it very rewarding to be in the field because I can help people in the community make healthier choices and living a healthier life. The best part of any profession, and especially with dietetics, is getting to work with people. And since we're all about food, getting to work with people and food, what's going to be better than that?
The Academy of Nutrition and Dietetics is your source for everything you need to start your path towards a career in dietetics. To learn more, visit eatrightpro.org/career.
Okay. Yes, that was a nice overview. So you see, dietitians, nutritionists are not only working in hospitals and nursing homes, but they could be working in the community, health centers, anywhere food is served. There is someone who is looking to see that it is served safely, that it is properly prepared, and that it is healthy in all these centers. So they hire a consultant nutritionist or a dietitian put in the Department of Health to oversee these places. And nonprofit and profit organizations may hire consultant dietitians to oversee the certain cafeteria and provide sometimes counseling for their employers to keep them healthy. And also dietitians and nutritionists can work in weight loss centers and, like I said, private practice as well. So there are many opportunities. Now, when you get an associate's degree at Bronx Community College in dietetics and nutrition, it is really just a stepping stone. In other words, you have to go on to a four-year college to complete a bachelor's degree in dietetics and nutrition to be able to work in that field. And fortunately, we have a articulation agreement with Lehman where we can use our 60 credits at Bronx Community College and take the 60 more at Lehman to complete a bachelor's degree in dietetics and nutrition. Or you can do option 2, a bachelor's degree in food service and nutrition. So both options are available. Option 1, it is more intensive. After your bachelor's degree, you have to do 1,200 hours of an unpaid internship before you take the registered dietitian exam. And in the year 2024, then these individuals will have to obtain a master's degree before they can sit for the registered dietitian exam. So if you don't want that option 1, there is option 2 that you can complete a bachelor's degree and get a degree in food service and nutrition. Okay. So what is the salary outlook? As a registered dietitian, it may start from low in 56 to 71. And as a technician, it may be in the 40s. Food service, food manager, may be in the 50s and 60s. So it's various employment possibilities. And the field is open. You know, there are whole issues around food and food security, sustainability. All these issues need skilled people with skills, nutrition skills. So the employment is great in these areas. If you have any questions, remember we will be here at the end of the session, but let me also talk to you about a very exciting public health degree that you may also be interested in.
Charmaine, I just want to remind you, we only have about 10 minutes left. So we'll just have a couple minutes to go over public health, and we want to make sure we have time for questions.
Thank you. Thank you, Erica.
No problem.
Public health is a vaccine that prevents disease.
Public health is a scientist who discovers the source of a salmonella outbreak.
Public health is outreach that helps prevent tobacco and drug use.
So what is public health? While a doctor treats individuals, public health looks at the health of a community. We research the risk of disease and injury in a population and take action to prevent them before they occur. Our early successes help stop the spread of infectious diseases by improving housing and sanitation. With a greater scientific understanding of health, well-being, and equity, we introduce prevention and early detection activities that help increase life expectancy by more than 20 years.
Public health is access to prenatal services for healthy babies and moms.
Public health is safety advances like seatbelt laws that have saved millions of lives.
Public health is access to contraception and education to prevent sexually transmitted diseases.
Public health was founded on the principle of social justice. As a basic right, everyone should have the opportunity for good health. But today, improvements in life expectancy have slowed, and we do not live as long as people in many other countries. Did you know? Only a small amount of what affects our health actually happens in the doctor's office. In fact, our health is mostly determined by the social and physical environments in which we live, learn, work, and play. Forget genetic code. A zip code can mean a difference in 15 or more years in life expectancy, even if you live a few miles apart. Nearly half of Americans live in communities with unhealthy levels of air pollution. And the Flint, Michigan lead crisis taught us the dangers of our aging water system. Poverty and poor health go hand in hand. Too many workers are denied a livable wage. They can't escape poverty when their health suffers. On-time high school graduation is a leading indicator of good health, but more than 20% of students miss this opportunity. Too many neighborhoods lack healthy, affordable food options like fresh fruits and vegetables. Addressing these complex health challenges require cooperation across many sectors. Thankfully, public health has taken the lead in working with government, community organizations, and businesses.
We partner with city planners to design safe communities that encourage physical activity, bike paths, public transportation, and parks.
We support Medicare, Medicaid, CHIP and the Affordable Care Act as steps to quality in affordable health care.
We advocate common sense measures to reduce gun violence. We can reduce gun deaths the same way. We partnered with road planners and car engineers to address auto fatalities.
So what is public health? It is all of us, working together to make sure our communities are safe, prevent disease and injury, and give everyone the opportunity for good health. Join with APHN as we create the healthiest nation in one generation.
Okay, so that's a very good idea of what public health is like. A lot of health promotion and disease prevention. And so examples of careers in public health, if you have an associate's degree, you can work as a community health worker, patient navigator, contact tracer, an outreach specialist, all those things. Jobs that require a bachelor's degree or higher would be working as a health educator, epidemiologist, health teacher, and other things like public health, social work, and environmental health specialists. Okay, now we also, each summer we have various internships that we can get our students involved with so that they can have an idea of what it's like working in public health. But one can work in hospitals, clinics, insurance companies, federal agencies. And we recommend a bachelor's degree, you know, at Hunter, Brooklyn College. You use our 60 credits here and go on for another 60 at these four-year institutions. And you can get a master's degree, CUNY School of Public Health. You go on for a doctorate degree, and salaries can range from $50,000 and up. Okay, that's it.
And this is how happy you'll be after you get a degree in one of our programs.
Great, thank you so much. This was super helpful and very informational. I want to make sure that we just have a quick minute to go over admissions next steps. So if you are interested in continuing and pursuing at BCC, we want to make sure you know what to do. So I'll quickly go through that with you and then leave it to you for any questions. So for those of you that are ready to apply and haven't started the application yet, the process is very simple. All you need to do is start your admissions application on the CUNY website through the CUNY application, which is listed right here. We'll also put that in the chat. There is an application fee of $65 for freshman students. These are students that have only completed high school or a GED or high school equivalency. And the fee for transfer applicants is $70, which are students that have attended college before. If you do require a fee waiver for any of these, you can always just email CUNY directly or us at our admission email, which we'll put in the chat. You just need to write a brief statement of why you would need a waiver, and we're happy to request this on your behalf. Now, if you're only applying to one college, we highly recommend, and that college being BCC, of course, we recommend that you submit your official documents. These are your official transcripts from high school or college, if you have attended college. We want you to send these directly to us at our admission email so we can process your application as quickly as possible. If you have your official documents sent directly to us, we can give you a decision for admission within a couple of days. If you're applying to multiple CUNY schools, which you can do through the CUNY application, then your best bet is to submit your document through the CUNY Application Processing Center. All of those instructions are prompted and given to you after you complete your application online. It does take much longer to process, generally about 4 to 6 weeks. So if BCC is your top choice, please just work with us directly and we'll get you through the process very quickly. Now, once you've submitted your application, you want to make sure that you're checking your email frequently. We recommend daily because we will be emailing you with important updates, deadlines, and reminders. So make sure that you're staying on top of things. We'll also know about any important events today and about registering for classes. You can also check your application status online at any time through your CUNY First account. And you'll be able to create this account after you submit your application. They actually prompt you to go ahead and claim your CUNY First account, and this is going to be your portal to review everything about your application. And also when you're a student here, you'll be using this very often as well. Also want to make sure that you're submitting your financial aid application. This is how many of our students at BCC do cover their tuition costs. So you want to submit both your FAFSA and TAP applications right away. This can all be done online through the FAFSA website. And these are the applications for federal aid and New York State aid. And through these applications, you could potentially be eligible for grant money, which is essentially free money for you to help you pay for college. And you could potentially be eligible for over $11,000 per year, depending on what your total household income is. The application is pretty easy. It actually links directly with your IRS tax returns to get all of your income information, and it will tell you how much you're eligible for in grants. Like I said, the maximum amount is just over $11,000 per year. And the cost of BCC tuition is extremely affordable, just over $5,000 per year. So you can see if you do the math, if you're qualified for that maximum amount of grants, that would more than cover the cost of tuition per year at BCC with additional funds left over for school-related expenses. And that gives you wiggle room even if you were not covered or not eligible for the maximum amount of grants. Now, once you've been accepted to BCC, I know many of you that are here today have already been through the process and have been accepted. So if that is you, congratulations, and we're very excited to welcome you to BCC. You want to make sure that you commit to BCC so we know that you are next coming here and you plan to be a student. You can do this by clicking the I accept button in the email that you receive from us, or through your CUNY First account by clicking I accept the offer of admission. You can also just email us at our email address here, iacceptbcc@bcc.cuny.edu, and we'll go ahead and process that for you. You want to do this as soon as possible because this allows us to get you registered for classes. And then that's the last step in your admissions process, is registering for classes. After you've committed and accepted the offer of admission, we'll go ahead and email you with an invitation to meet with an academic advisor individually. You'll be able to meet with someone via video chat virtually to go over major, select your course schedule, go over any questions that you might have about getting started, and actually create your schedule for the fall semester. So that is what I wanted to share with you today. This is our contact information for the Office of Admission and also the Office of Financial Aid in case you have any questions after the presentation today. Natalie has shared a lot of helpful links in the chat, so that will be useful for you. Feel free to take a screenshot of that or save the chat. This way you can refer back to these links after today. And I do want to open it up to you for any questions that you might have for our presenters today or for us here at admissions. So I will open up the floor. You can feel free to unmute yourself if you do have a question.
I have two questions.
Sure.
Okay, when they send the Gmail for the tab or the thing for the financial thing, if they send a Gmail of that, is because you haven't sent it, or it's just they will send it?
I'm sorry, can you repeat that question?
You know the tab, the financial thing?
Yes.
Okay, they send me one. It's because I haven't do it, or it's because they always send it?
What did they send you?
A Gmail for my FAFSA and tab, but I think I already have done it before. That's why.
You have to do it every year. So if you've done it previously for like another school or something like that, they might be sending you a new application to redo for this school year and for BCC specifically. So if you haven't done the 2021-2022 application, you want to make sure that you submit that and make sure you submit it for BCC. Natalie also just shared in the chat a link to our financial aid office. They have their contact information there. They also host a virtual session every week. So you're welcome to connect with a financial aid counselor live, and you can ask them to look into your individual account.
Oh, okay. And another question is the program for, I sign up for psychology, but I can change anytime for charge and pedagogy.
Yes, you can change your major. You don't want to take too many classes in one major and then change maybe halfway through. While you can, you may be required to take some extra classes. So if you haven't even started yet at BCC, you definitely have plenty of time to change your major during your advisement appointment. When you meet with an advisor, you can go ahead and change at that time. You can also email us at admissions and we can update your major for you. I hope that
Okay,
answers.
thank you. Yeah, thank
You're
you.
welcome. Any other questions?
David,
Yeah,
I'm just saying to David, he asked about my information. I put it up in the chat, David. If you move up, you'll see my email address, David Thompson.
Great, thank you. And Natalie just shared it once again in the chat.
Thank you.
We'll also be uploading this video, the recording of the presentation, to our YouTube account. So anybody that would like that will have access to it likely by the end of this week or early next week. So stay tuned for that if you would like to view the presentation again. We have a question in the chat from Cassie Lee. The student wants to take nursing and dietetics. Can either of you speak to that?
I'm unclear. She wants to take nursing and dietetics at the same time.
Right. I know
I'm interested
in allowed two majors here, but is dietetics a possible pathway to a four-year nursing degree?
Yes, it is. As a matter of fact, half of our students who, well, most of our students major in dietetics and nutrition, half of them are really planning to get an associate's degree in dietetics and nutrition, and they want to go on to a four-year college to do 2 more years for the Bachelor of Science in Nursing at a 4-year nursing college. So they save money by coming to the community college, getting the associate's degree, and then they go on to sometimes a private college in nursing. Because the anatomy and physiology, the nutrition, all these subjects align nicely with the nursing pathway. So yes, you can come to BCC and do that.
Great, thank you so much.
Hi, I'm me again. I have another 2 questions. You gotta wait till next semester to make extra classes, like, you know, like to graduate like faster, I guess?
I'm not sure I understand, but if you do want to graduate faster, you can take classes over the summer or over the winter sessions to accelerate that time. That's typically how students will graduate faster than the traditional 2 years for the associate degree.
Okay, thank you.
You're welcome. Great. Any other questions? Okay, well, if there are no other questions, you are free to leave for the evening. But if you do have questions, please stay on and we're happy to answer them.
I have one more statement that
Sure.
The positive thing about a community college is that you get a lot of support with maybe it's math, maybe it's writing, maybe it's biology. Community colleges are designed to give you all that support and strengthen you. So when you go on to a 4-year college, you may perform better than people that have entered the 4-year college and have less supportive assistance. That's the feedback that we have been getting, that our associate's degree students sometimes, many times outperform the traditional four-year students. So we're happy to have you here and to give you the support that you need. And don't be ashamed to get all that support. It'll only strengthen you for your future career.
Yes, absolutely. Thank you for that, Charmaine. We definitely have many support programs at BCC that make our students very successful and can help really that transition to college. So we certainly encourage students to start at BCC, and you can really finish anywhere. Cassie Lee had a follow-up question, I think, asking about taking dietetics first and then taking classes for nursing. So I'll just say, Cassie Lee, that's, as Professor Charmaine mentioned, that is one pathway to a four-year nursing program, is starting with the dietetics program at BCC and then transferring to a four-year BSN or Bachelor's of Nursing program. We also have a nursing program here at BCC. That's a two-year degree, and that's an RN certificate. So we do have that program. If you wanted to opt for that, you'd have to start with the prerequisite sequence for the RN program. There is a separate application process for that program. We'll likely be hosting another session on that in the future, but we're happy to share information on the nursing program if you're interested as well via email after today. Okay, any other questions?
My last question, I promise. I get into the program of the MetroCard and all that. I forgot how to call, but if I get into that program, I can also get into for the helps of the college, for the TAP and all that.
I'm not sure what program you're referring to.
Because when I was like making the appointment when I was in the call for making the schedule, they told me a program that they can help me with to give me a MetroCard and like a lot of things.
Oh, the ASAP.
That one. The ASAP program. So what was your question? Did you have a question about the ASAP program?
I will be able to have to give TAP to. Can I receive both or just one?
You can receive financial aid and be part of ASAP. It's not exclusive, one or the other. So the students that are in the program, they also receive financial aid for the most part.
Oh, okay. Thank you.
Great, thank you, Natalie. These are great questions. If there's any more, please let us know. I know we're a little past our scheduled time, so if you do have to leave, we are finished with our formal presentation. So thank you for those that joined, and a big thank you to our presenters tonight. And if you do not have further questions, have a wonderful rest of the evening, and please stay in touch with us and feel free to reach out if there's anything that you think of after today or need any help with the admissions process. Okay. All right.
Thank you, everyone.
Good. Thank you so much.
Thank you.
Thank you, Anna. Thank you, Charmaine.
See you soon.
Of course. Yes. See you soon.
On campus.
All right. Bye.